My name is Ashley Zlotnicki. I'm going to show you how to insert an IV today on this arm. So first we're going to check our order for accuracy. I have the order, it's good to go. I'm doing my hand hygiene and then gathering all of my equipment. So I've got my stat lock, got my catheter, my needle, J-loop, my flush, gauze, alcohol swab, tourniquet, and we're pretending that I have gloves. Alright, so first thing we're going to do is patient identifiers, so they tell me their name and date of birth, and then we're going to provide privacy and then assess which is the patient's dominant hand. I'm using their non-dominant hand today. So then we're going to select a site. So I look around, I think I want to go for the AC vein up here, so we're going to go for that one. And then I'm going to apply the tourniquet, and I'm going to choose a 20 gauge catheter. I know that because it's pink. And then I will wipe it down with alcohol. So you can see tourniquet's on now. I wipe down this while I let it dry. I do more hand hygiene and I put on my gloves. So now my gloves are on. We're good to go. We're letting it dry, don't blow on it, and don't put the needle in until it's dry because it can cause burning. All right, it's dry now. So we're going to have the needle bevel up, insert it at no more than a 30-degree angle, and apply traction to the vein. So that's what I'm going to do now. Inserting it. So, all right. Inserted. Then I'm going to advance it somehow, some way. There we go. All right, this will go in the sharps container. We're gonna pretend that I have one right now. And then we're going to connect our J-loop really quickly. That was already on there. Okay. Touching it now. Alrighty. And then we're going to want to clean any blood from the site. I don't have any. And then you're going to apply your stat lock. We're going to say that I applied that to save this one. And then you're going to apply your transparent dressing and then take off this tourniquet right here. Tourniquet's off now. Once your clear dressing is on, you're going to label your clear dressing, and then we're going to check for blood return and flush it. All right, so blood return is good. Now we can flush, and the IV is good. So then we're going to chart the date and the time of the IV insertion, the patency of the IV and the size used, which is a 20 gauge, the dressing used, and if the IV was leaking, difficult to flush, or any position that it is in, and also the tolerance of it. After that, you're going to dispose of everything into the proper containers, biohazard, sharps, and we're good to go.